So, I left you earlier with quite a terrible situation, but I tell you that things would get better. And what happened after that is something that has been called since the Frankfurt Way. And in short, the Frankfurt Way was a new approach, something that has been described as a balanced approach of all agencies involved in drug policy and practice in the city of Frankfurt. It is a participatory process, it is consensus-based in order to have an integrated local drug policy. What's also interesting is that it has survived many political changes. There have been several mayors since, and this policy has endured, and it still serves as a model for other cities as an example of sustainable drug policy. At the time when the problems with the open drug scene reached their peak, so that was this peak in drug-related overdose deaths and the high incidences of HIV and hepatitis infections, when all this reached their peak at the end of the 1980s, an approach was developed which was, well, it was differentiated and it was also acceptance-oriented, which meant they basically accepted that drugs were still going to be around for a while. And it's aimed at both protecting the population and also reducing the harms caused to users by the illicit substances. It also meant that repressive means, as in police crackdowns, were directed toward the traffic of illicit drugs and not against drug-dependent people and the communities they lived in. These measures were closely connected also with health and social services for drug users. And now you're going to ask me, what was the result? Well, the actions initiated from 1992 onwards not only resulted in a decline of drug-related deaths, it did, because the number of drug-related deaths sank from 147 in 1991 to a figure in the low 20s in recent years. So not only a decline in drug-related deaths, but also a clear decline in criminality. And now I'll give you a few milestones about what was done. First of all, in 1988, they started a multi-agency interdisciplinary cooperation in local drug policy. This was something that was called the Mondays Round. And the Frankfurt Mondays Round was a committee which was formed by the mayor to try and bring together experts working on drug-related issues. It met bi-monthly, on a Monday, hence the name, and they met to adjust the policy and practice of the magistrates, police, prosecutors, of the Municipal Drug Policy Coordination Office, and representatives of the local drug services. The Mondays Round is still working successfully today. As I said, it is a participatory, consensus-based process of integrated local drug policy, and it has now more than 30 years' experience in developing recommendations for drug-related topics. Services related to harm reduction were also expanded. For example, the first methadone program operated by the local health authority started with only 25 clients. That was at the end of the 1980s. Only 4 years later, this number expanded from the original 25 to 700 patients. And in addition, they opened drop-in centers. They even call them low-threshold drop-in centers. Basically, they're just centers where people can go with minimal formalities, so basically anyone can go there. And they were a key strategy to approach drug users and to support them in the prevention of infectious diseases. How? Well, by providing them with sterile injecting equipment. or condoms. Basically the kind of things you need to prevent the spread of infectious diseases. And also these drop-in centers were the perfect place to communicate messages about safer use and how to prevent irreversible damage. A needle exchange service was also introduced, and that was not only in all these drop-in centers, but there was also a mobile service. What you have to imagine is a van going to the places where drug users would meet. Of course, I've talked about Frankfurt so far, but Frankfurt is not the only city that had a drug problem and that was trying to face it in a smart way. There were other cities like Zurich, Amsterdam, and Hamburg. And in 1990, Frankfurt hosted representatives from Hamburg, Zurich, and Amsterdam, and they crafted and signed what was called the Frankfurt Resolution. The text of the Frankfurt Resolution began with a fairly blunt assessment of the general context. And I'm going to give you a little quote there. It started with this sentence: "The attempt to eliminate both the supply and the consumption of drugs in our society has failed." That's fairly clear and fairly blunt. The resolution recognizes that substance use cannot be eradicated by drug policy, but rather that people who do use drugs should be offered assistance and support to reduce the harms that are associated with their drug use. And to meet these aims, the resolution proposed a dramatic shift in priorities in drug policy. And for that, they decided to draw on the experience from other cities. For example, Amsterdam opted for a policy of tolerance towards soft drugs and prevention in schools. I think everyone more or less knows that about Amsterdam. And today, Amsterdam has a smaller percentage of soft and hard drug users than any of the countries that practice zero tolerance. So looking to the drug policies found in Amsterdam, the resolution resolved to make a distinction between cannabis and other illegal drugs by making the purchase, possession, and consumption of cannabis no longer constitute a penal offense. And also the idea was to distribute sterile syringes to drug users and maintenance with methadone. Also, they decided to follow the example of another city in Switzerland, Bern. It was a city where the first officially sanctioned drug consumption room was opened. That was way back in 1986, so 4 years earlier. And looking at this example, the resolution advised cities to allow the establishment of good health rooms, or as they seem to be now more commonly known, consumption rooms, in which drugs can be consumed under supervision. It also encouraged the establishment of what they called a trial within a scientific framework to analyze the effects of controlled prescription of drugs to long-term drug users, basically administering drugs under the supervision of healthcare professionals. And this was something that was widely spread in Switzerland. A lot of cities in Switzerland were instrumental in exploring the idea of heroin-assisted treatment. And this is a service that now enjoys great success and is also available in the UK, for example, in Germany, in the Netherlands, and in Canada. So later on, in 1992, Frankfurt opened one of the largest drug user service centers in Europe. And in this center, they would offer methadone maintenance. They would also offer a syringe exchange. And in 1994, 4 drug consumption rooms were established in Hamburg and in Frankfurt. That may seem in line with all I've said so far. What's interesting, though, is that these drug consumption rooms, although opened since 1994, were not made legal until the year 2000. So for 6 years, they seem to just function in complete illegality. And now you're going to ask me, I'm sure, what's the situation in Brussels? Well, in Brussels, as far as I can tell, the city and the region have been talking about opening 2 drug consumption rooms, and I found discussions online about that in 2018, 2019, and they are supposed to be opened at some point in 2020, but I couldn't really find anything more concrete on the topic. So we're about 25 years later than the establishment of those drug consumption rooms in Frankfurt, and there's still none in Brussels. Sorry. The Frankfurt resolution still continues to have an influence on drug policy reformers. And this is something that you can see in a report which was released recently, last year actually, by the Drug Policy Alliance, which is a US-based think tank for drug policy. And this report traces numerous city-level drug policy innovations, and it does cite the Frankfurt Way and also more recent initiatives which have been launched in North American cities like in San Francisco or in Vancouver. But I think this is really what's important with the Frankfurt resolution and the Frankfurt Way. It is, and the reason why it is so important for people who do advocate harm reduction nowadays is that these policies showed that local municipalities, cities, can care for their residents even if the regional and national governments fail to do so. Thank you very much.
Oh, il est tard, allez ce soir.
Ouais.
On a